There is good news. Hello there. Welcome or welcome back. Yes, I am wearing the same shirt as I was yesterday at the doctor. It was just easier than changing my shirt. So, I'm Julie. This is my journal. Welcome or welcome back. I am on some pain medication today, so if I look a little wacky and sound a little wacky, that's part of it. Also, the air is incredibly bad here in Utah. I'm not sick, but my allergies are absolutely out of control because the air is so incredibly bad. It's inversion season here in Utah. Yay. So, I did go to the sports medicine doctor yesterday. I wasn't planning to, and was incredibly lucky Wednesday to get an appointment for yesterday, Friday. There must have been a cancellation. I had been doing pretty well since the last injection, which was on this elbow. When I say injection, it's not just one injection. It's ultrasound guided wet needling. So they go in with a numbing agent and I think like saline or so, I don't know. And they're watching your joint situation on the ultrasound, and so they can guide the needle directly into the affected diseased areas, which is wonderful. I had my right elbow done for the first time last October, and then had this one done around Thanksgiving. And we had been planning to do Tenex, a surgical procedure in the hospital on this one, but then nobody called me from the office like they were supposed to. And so then I had more time to think about it, and it freaked me out because I realized you're not under general anesthesia, and which I think I already knew, but it like kind of hit me that, oh my God, I'm going to be awake, like in a, sedated, semi-sedated state, but awake when they do this, and it freaked me out. So I didn't bother to call them to say, hey, why haven't you called? Nope. I was like, no, we're not doing that. And I've been seeing the massage therapist about once a week, and she's been working on the muscles and tissues surrounding my elbows. And I've also been wearing the these support brace things. Most days I wear them all day and all night. Not always, but pretty much, and altering like my activities and stuff to try to give my elbows a rest. But I had been doing some Lego videos that I just need to do the voiceover for. I had to order a new connection for my microphone because the other microphone died. Anyway, let me see if I have a cough drop. Just a sec. Okay. Hopefully that helps. In a minute, it will. I'm gonna have to get some supplementary allergy medicine just for the inversion. So anyway, yeah, I was doing Legos, and then the weather, we had a spot of really nice kind of springtime weather, and so I wanted to get a jump on spring cleaning, and there were some particular spots, specifically the front door. You might have seen that video on our main channel, the Frugal Family, that day I was going around scrubbing spots and sections of walls and doors and trim and, door jambs and entranceways and stuff like that, high touch areas, and the stove, I did that all the way around and swept out behind it and, stuff like that. Spring cleaning, deep cleaning. And it was so wonderful, sorry, I'm sweating like a pig. It's the pain and the medications. Let's see. So, that night, after I did the scrubbing and the cleaning, and it wasn't even half of how much I wanted to get done, but it was enough that I felt like, hey, good job. I can see the difference. That night I was in absolutely horrific pain, and the next day as well. Luckily, when I got this elbow done, I only used half of the pain medicine that he had prescribed. And so I had the other half of the bottle left over and was able to take half of a pill to help me sleep that night. which was wonderful. And then the next day took another half of one because it was still horrific. And I called, and hallelujah, they were able to get me in yesterday, Friday. Like I said, there was probably a canceled appointment. And I'm so grateful for that. But let's get to the really good news. There is good news. There's good news. And I'm so excited to tell you. And right now, it's what's keeping me going, because I'm miserable, right? I'm in a lot of pain. Even with the medication, it feels like my elbows are going to explode. The one that was treated and the one that wasn't. We'll do this one in a month. I need to let this do its thing, and then we'll get this one done. And it shouldn't be as bad, because it wasn't as bad as this one. Anyhow, good news. Let's talk about that. So when I first went in to see him, and we were talking about it and next steps and what the plans are, he had actually been talking about, well, maybe you're going to need to have surgery. And I was like, that's what I've been trying to avoid, any more freaking surgeries. But then we went in and, got the ultrasound going, and, he was, and they do both sides. So they go in this way and, over here this way. So they go both sides. And this side was horrific. I feel so bad for anyone that was other patients in the office. I did my best to, tone it down and try to breathe and everything, but oh my God, it was awful. It was awful. Was it as bad as the time that he did this in October? No, but it was still so bad. It's so painful. They go in with this ginormous needle and they start numbing. Well, while they're numbing, of course, you're feeling all of it. And then after you get numb and they continue into all those areas, there's the pressure. The pain medicine doesn't take the pressure away. And so you feel like it's just filling inside of your elbow. And oh my God. Then he did this side and it hurt and it was pretty bad, but it wasn't nearly as bad as the other side. So, hey, that's great. Anyway, so once he saw it under ultrasound, and as he filled them with fluids and was able to get a much better picture, he was like, actually, there's significant improvement. And I knew there had to be, because as much as it hurt, it wasn't as hellish as the first time he had done that elbow, And so, I was quite certain that something had to have changed. And he was like, no, there's significant improvement, because he had seen the images from last time and compared them to what he saw this time. And he was like, actually, those tears and diseased areas and are smaller. Can you believe? Like, we started the appointment with him saying, yeah, we're probably going to refer you for surgery, to the end of the appointment with, there's significant improvement. I don't know. I wasn't expecting that or thinking about that. All I wanted was pain relief. Like, please get in there and let's do something to help it feel better, which it makes it feel incredibly worse first. It's pain fighting pain. So short term, absolutely horrific pain to fight the long term, suffering. And so that's all I wanted, was to be doing something proactive to get some progress going on. Let's alliterate with these. I'm on pain medication. Please be patient with me. Look at all these pee. I was thinking about peeing, which I did right before this video. So anyhow, he said significant progress, improvement, whatever. And I'm like, oh my God, good news. I'm so happy for good news, especially because, so I had the job interview to be the art teacher, and no, I haven't heard back yet. He had said that Friday would be the soonest they would know, but more likely it'd be like somewhere Monday through Wednesday, because your name has to be submitted through a chain of command, whatever, through the school district. So after the interview with the school principal, my first thought was, oh my God, what have I done? How can I be an art teacher with these elbows? Glitter, glue, scissors, paintbrushes. How am I going to do that with these elbows? And I had pretty much decided it's not a job I can do. I don't want them to offer me the job, because how am I going to do it with these elbows? Progress has happened. There's been improvement. And he is like, if it continues going this way and you keep doing what you're doing, which is wearing the things, altering, my behaviors, and not overdoing it, and continuing with the massage therapy and all of that, and the, wet needling, we might not need surgery at this point. If it continues this way, I mean, it might heal, which I'm so happy. So the plan, let this heal up for this time, get through this recovery, and then in a month, redo this one. And then, in the springtime, probably, for sure, go back and do this one again, probably in so let's see, I did October, November, December, January, 4 months. So maybe February, March, April, May, maybe in May, go and do this one again and see what it's looking like in there. And hey, howdy, maybe we'll have done enough to stave off the deterioration, the disease, all of that, enough that we don't need surgery and can just continue on in this life. And it's not like it's a one-time thing where then it's fixed. And he reminded me of that there's not a guarantee or an immediate answer of, 1 + 1 = 2. It could be that we do these and make significant progress. And then later on, in fact, it's likely we'll have to, do this process again to keep them going. But to avoid surgery, even if it's like putting surgery off for, 5 or 10 years, I will take that. I will absolutely take that. And we don't know what medical advancements there will be in 5 or 10 years, And so, I mean, look at 5 or 10 years ago, just in anything and everything, except for minimum wage. Don't look at that. That'll just upset you. But in a lot of other areas, we have progressed and made advancements, and who knows, what'll be available by then for my elbows and all my joints. It boggles the mind. Who knows? Who knows? They might just implant some little chip or little something that just, rebuilds. So there is good news. And I wanted to share that with you guys and let you know what's going on. And, I do have, a couple of videos that, I made ahead, or at least got started ahead and can finish up, and we'll be posting those over the next couple of days. Some exciting stuff, some fun stuff, some family stuff, some kitty cat stuff. And I will, of course, also be journaling through this process and talking about it. And we're also going to talk about my hair loss. My scalp is thinning like crazy. I'm back on the Rogaine, trying to do that twice a day. The problem is it makes my hair so gross and then makes it look like I have dandruff. But since forced menopause, oh my God, I'm just losing, my hairline is just going, and I can't handle that. I absolutely can't handle that. So I'm doing the Rogaine again, and I'm going to see another doctor that maybe can give me some other options and ideas. I'm taking collagen 3 times a day. If you guys have suffered with postmenopausal hair loss or hair thinning, please tell me about your experiences in the comments. I am going to be doing a separate video about the hair loss, like, oh my God, and hair thinning. And if you have stuff that's worked for you, whether it was prescriptions or Rogaine or I think there's like rosemary oil. I'm going to get some of that. I just want to use up the Rogaine first because I already bought it and it's really expensive. And then I'll switch probably to the rosemary and hope, because it's shown to have basically the same results as Rogaine, but hopefully it won't be making my hair so gross. I don't know. I can't wash it myself right now. Luckily I took a shower yesterday because that's really hard to do. With the elbow, it's basically useless. Like I can't lift anything. There's no strength at all. None. It's just because it's shredded and then it's had needles go all the way through from both sides, and then, and it's just absolutely useless right now. I can't do anything with it. So showering and all of that and washing my hair is impossible right now, but I can do the Rogaine. And then I'll have one of the girls wash my hair for me in a day or two. Anyway, but if you guys have stuff that has worked for you, please, oh my God, please tell me, specifically postmenopausal. People lose their hair or their hair thins for a million different reasons. Obviously men. Hey, Lulu. There's my Lulu in the background. Hey, baby. She's getting ready for work. Anyway, women though, like men, obviously there's like male pattern baldness and stuff like that. That's a whole different story. But for women do lose their hair, or it thins, or their hairline goes back for a million reasons. For me specifically, I'm almost certain that it's because of the forced menopause, but I am going to see a doctor to confirm that, or see if there's anything else that we can do. But if you have stuff that has worked for you, or experiences that you can share that would be insightful, useful, helpful, I would love for you to tell me all about it in the comments. And then, like I said, we will be doing a separate video talking about it. Luckily, I can kind of comb it over. Comb over. I'm doing a comb over. But anyhow, we will talk about that more. I'm going to rest for a little bit and probably have another coffee, and then I don't know. I don't know what I'm going to do. I know that the rest of today, it's going to be continuing pain. And then tomorrow, the third day is usually the worst when it comes to surgical or semi-surgical procedures. And so tomorrow will probably also be pretty damn awful. Well, luckily it's the weekend and we'll get through it. And then this coming week, hopefully the recovery isn't as long this time as it was the first time I got this elbow done. I'm counting on that. I'm so hopeful. And then, we go from there, and then we find out one way or the other about the art teacher job, and we step into whatever is the next phase of my life, whether that's working this job with the school district, or joining a book club and doing other things to socialize and live stream with you guys, and whatever else is going to happen. I don't know. We shall see. But for today, I'm going to try to rest and let my body do what it needs to do. But we have good news, and I'm so excited for that. If for some crazy reason you guys are still watching, please, in the comments, just type good news. That's it. Good news. And can't we all use some good news now and then, in this time that we live in? Good news is so rare. It's so rare, but if you look for it, there's good things happening all the time. And I am thrilled to be able to share some good news with you. Anyway, have a wonderful day and a fabulous, beautiful weekend. I've been Julie. This has been my journal. You guys have been wonderful, and I will see you all very soon.